radiation monitoring device that most clinics use is going to be a dosimeter badge. Okay, when the dosimeter badge is heated as it is by the radiation from X-rays, beta rays, and gamma rays, which you would be exposed to while taking radiographs, the crystal chip in it produces light. This light is equal to the amount of radiation you're exposed to, and the device measures the amount of light. And that is why it is important that your dosimeter badge, when it is not being used or taking radiographs, that it is kept in a dark place where it is not warm. So you don't want to put it in the dryer or leave it in the car, because that will give you falsely high readings. We obtain the readings from the dosimeter badge depending on the clinic you work at, usually quarterly. So the radiation badge I have right now is used from October 1st to December 31st. Whatever company it is that we got the dosimeter badge from, which ours is Mirion Technologies, we send in all of the dosimeter badges and they send back a report. The dosimeter badge should be used anytime a person is taking radiographs, digital or non-digital. It should be worn outside of the protective equipment from the thyroid shield to make sure that it is not hidden behind any of the lead gear at all. The maximum permissible dose, so the MPD per year per veterinary staff member, is 5 REMs. We're going to go over dosimetry reading. So this is what it's going to look like for the company that we get it from. So it has all of the different names of the employees here, and then it's going to have the deep eye and shallow amounts of radiation. So let's see, it has here, so this is going to be year to date. So you can see on here that it is lower than the maximum permissible dose of the MPD, which is going to be 5,000 milligrams. All of these, so even the worker, the staff member that has the highest amount of milligrams still has only 44 milligrams out of 5,000, so it is well below the yearly permissible dose. And then the lifetime to date, the highest one is 715, which is milligrams, which is significantly lower than the maximum permissible dose. So there is 4 different kinds of personal protective equipment generally used in veterinary clinic radiology. The 2 PPEs that we have at this veterinary clinic is going to be the apron. So this is a lead line apron. And then a thyroid shield. The other personal protective equipment used in radiology that this clinic does not have is going to be goggles, so lead line goggles, as well as gloves. After your personal protective equipment is on, you need to place your dosimeter badge. It can be placed either on the thyroid shield or the protective apron, but it should be on the outside of the protective lead equipment. So now I'm going to be checking the protective equipment. So if there is going to be any cracks, creases, or breaks, then the protective equipment is going to be ineffective. So you just look to make sure there is no cracks, creases, or breaks. Some of the ways to prevent getting any cracks, creases, or breaks is making sure that the protective equipment is hung up and not folded. And then also, if you have any sort of gloves or anything, making sure that they are not bitten or scratched by an animal, because that will break them. Okay, same with the thyroid shield. I'm making sure that it is not creased, cracked, or broken. And both of these look good. Generally, the maintenance for the personal protective equipment is going to be checking them with radiographically every 12 months. And you can do this by taking radiographs at milliamperage per second and 80 peak kilovoltage. So the 3 methods of restraint in radiology are going to be sedation, directly handling the patient, and positioning aids. So sedation is going to be a chemical sedation performed by a doctor. The animal is going to be sedated. It is a lot easier, a lot stressful for the clientele, the staff members, and the patients who generally are uncomfortable, scared, and in pain when they come in for x-rays. Next one, the direct handling the animal, is where staff members directly hold and manipulate the animal to be in the positions they need to be for the specific radiographic images. And the last one is positioning aids, so wedges and sandbags and troughs are primarily used to position the animals, and then that way the animal will be positioned the way it should be. Staff members can be away from the radiographic machine, reducing the amount of radiation they're exposed to. There are 3 main positioning aids used in radiology in veterinary clinics. The first one, and the main one used for ventral dorsal radiographic images, is going to be a foam trough. So you place the animal in the trough with their back, their spine in the center of the trough, and this helps keep their spine straight. Okay, the next one is going to be a foam wedge. So this you can place for a couple different radiographic images. Say you have to do a dog lateral and you want to keep the spine straight, you can wedge this under their thorax by their sternum, and it'll help keep the spine parallel to the table versus being a little bit more oblique. Last one is going to be a sandbag, and this one is also very nice for keeping the animal in position without having to be in direct contact with the dog, so minimizing exposure to the radiation. So it can be used in an assortment of different ways, either to keep, say you're doing the back legs or the lateral abdomen, you can use it to keep the forelegs cranial, or to keep the dog lateral by putting it over the neck, and then also use on the legs or the abdomen to keep the dog on the table. So besides the personal protective equipment, other physical barriers that can be used in radiology suite would be walls. So if you have another room or leaving the room, radiation is cumulative, so it is very important to utilize time and distance as safety measures. So increasing the amount of distance will decrease the amount of radiation exposure, and decreasing the amount of time spending taking the radiographs will decrease the amount of radiation exposure. So it is very important to try to get the radiograph image taken correctly the first time. So it is highly recommended also to use sedation and the positioning tools, especially if you have fractious animals that do not cooperate. So even if you are directly taking the radiograph, so staff members are holding the animal and no sedation or positioning equipment is being used, it's very important to not be in the direct beam at any point, even if you have the protective equipment on, including gloves. The gloves and the other protective personal equipment, the thickness of the lead is enough to protect from scatter radiation, but it is not enough to protect from primary beam radiation, which is significantly more. The amount of radiation from primary beam is especially dangerous because radiation ionizes the water in the cells, and this causes toxic products to build up, and those toxic products can damage components of the cell, including DNA. This is why it's especially important that people under the age of 18 and pregnant women are not exposed to any radiographs. They do not help at all with restraining animals for radiographs or being in the same room or within the 6 feet of any radiographs being taken. The reason that it's especially important for minors and pregnant women to not be exposed to radiation is that during the time of growth, so people that are under the age of 18, we're seeing a lot of growth, and then pregnant women where there is growth of the fetus. The cells during growth are going to be experiencing mitosis more often, and because of that, their different cellular components are going to be exposed more often, including DNA, giving more chances for it to be affected by radiation. At no point while a radiographic image is being taken should any unnecessary personnel be in the same room. As I said before, radiation is cumulative, so every attempt should be made to minimize exposure to radiation. So now I am going to request the x-rays for our dog. So what I'm going to do is, in this computer program, which is AVMA, I am going to push escape, which is going to bring up the client selection. To do this, the client's name is going to be Van Letten. So I'm going to type in Van, comma, and the animal's name is Buddha, so I'm going to type in B-U-D. I'm going to double click the patient's name, and then from there I'm going to go to the description box. You can see the description box right here, and I'm going to push F2. After that, to request it, I'm just going to put in digital x-rays, which I'm just going to start spelling digital, and I'm going to click digital x-ray package to views, and then I'm going to push done. For our next view, we're going to be doing the cranial, caudal, ulna, and radius. So I'm going to measure the ulna and radius, and that is 4 centimeters. So how I'm going to set that on the machine, we don't have a chart. The machine, all we do is put in extremity on the machine. I'll zoom in on that. You can see extremity, and then I'm going to do canine extremity, and then I'm going to put in the measurement of 4. So now the machine is ready to take the x-ray. This clinic's digital radiographic imaging machine uses cassettes. We do not have different variety in sizes. They are all the same size. So I have the cassette, and I'm going to now load it in the machine. So the black side should be up, and then these blue ends are going to be on the right hand side. And then I'm going to lock it in place and close it. Okay, so now we are going to take a radiograph of our dog. We are going to be doing the cranial caudal view of the ulna and the radius. We both have our protective equipment on. To minimize exposure, we have positioning aid of tape, and so I'm going to hold the tape to make sure that I am not getting my hands in the view, and I'm going to make sure that my restrainer is not getting her hands in the view also. So it is important that the dog stays completely sternal. And I'm going to collimate it down. And so we are doing the ulna and the radius. So the midline area is going to be the mid shaft of the ulna and the radius. The collimation is going to be right past the joints. So right past the elbow joint and then the carpus. And then I'm going to place my marker, and I'm going to do lateral of the left side. Okay? Alright, and we are going to take our radiograph. And since this is a digital x-ray with the cassette, I am going to load the cassette. So in this machine, you load it where the arrows are pointing. They're going to be on top and they're going to be pointing. And then in a few seconds, it is going to show up on our computer. So now we're going to do the other x-rays for our volunteer dog. So I'm going to type in the last name and then the beginning of the first name for the animal. I'm going to double click the client and the patient. I'm going to go to the description box. You can see the description box right here. I'm going to do F2, and then I'm going to type in the other description box up here. I'm going to start typing in digital x-ray and it will come up again. And so I'm going to do done. So now we're going to take the measurements for the ventral dorsal thorax. So you want to take the measurement at the deepest part of the chest. The measurement for this dog is 26 centimeters. I'm going to go to thorax, and then I'm going to do canine VD, and then I'm putting the measurement. The measurement for the thorax for this dog was 26. And now we're ready to take x-rays. Now for the VD thorax, I'm going to load another cassette. We are going to be doing a patient's VD thorax. So the positioning equipment we have is going to be this trough, and we're also going to have a sandbag. So first off, we are going to get the dog into the trough. So now that we've gotten the dog into the trough, I'm going to set the collimation. Okay, so the collimation is going to be set. The cranial border is going to be the thoracic inlet. The caudal border is going to be first lumbar of the vertebrae, and the midline is going to be the caudal border of the scapula. The other positioning aid is going to be the sandbag. So we are going to get the animal completely straight. I am going to use the second positioning aid for the front legs. So the sandbags are going to go right at the elbows, and that's going to keep the elbows down and straight. It's important for the VD thorax that the head is also straight. Okay, so I have my marker, and I'm going to shoot my image. And then I'm going to feed the cassette into the machine. Okay, and now for the last request, what I'm going to do is I am going to push escape. I am going to search the first 3 letters of the last name and the first 3 letters of the animal's first name and push enter. And then I'm going to double click the client and the animal. After that, I'm going to go to description. I'm going to push F2, and then I'm going to start typing in digital radiographs. And then I'm going to double click and push done. Lastly, we're going to be doing the measurements for the ventral dorsal pelvis view, and so we are going to be measuring at the deepest part of the pelvis, and so that is going to be the ischial tuberosities, and the measurement for that is 16 centimeters. On the machine, I'm going to do pelvis, I'm going to do canine VD, and the measurement is going to be 16. And now we're ready to take radiographs. And last, for the ventral dorsal pelvis, I'm going to load the last cassette. So now we are going to do ventral dorsal pelvic radiographs. OFA uses this primarily to check for congenital canine hip dysplasia, to make sure that animals with the congenital hip dysplasia are not bred and it is not passed on anymore. So now I'm going to do the collimation. So the cranial collimation is going to be the crest of the ilium. The caudal collimation is going to be right past the patellus, and we are going to center at the tuberosities of the ischium. Let's see, so we are at the let's see, the crest of the ilium. I'm going to bring this a little bit over, and then we are right past the patellas, and so I am going to make sure that it is parallel and level. I'm going to twist the knees, the patellas in to make sure that they are parallel to the table. I'm going to take the cassette out and then put it into the machine. So now we are going to retrieve a digital image. Since my clinic that I'm at uses digital imaging, it is going to be in a computer system. The computer system is Image Pilot. So what you're going to do is you're going to go to the search key right here, and I'm going to search an animal from a few weeks ago that we took x-rays on. The animal's name is Binks, and it's going to be our house kitten. So you just type the name in, so patient name, and I type Binks, and so then I'm going to push enter for search, and then it came up. So Binks Quill Hollow Animal Hospital. So I'm going to double click it, and then you're going to find all of your images at the bottom right here. Okay, so the radiographic contrast study that we're going to do is BIPS. So BIPS is an insoluble positive contrast agent. It is used to determine gastric motility or lack of gastric motility, figure out what emptying times are, as well as determine potential GI obstruction. BIPS stands for barium impregnated polyethylene spheres. So for this dog, we are going to, prior to giving the BIPS, we are going to do a survey x-ray of the abdomen. This dog has been fasted for 12 to 24 hours and has been given an enema yesterday, as well as about 4 hours ago, to remove fecal matter as well as to remove excess gas in the lower GI. So this is the capsule with the barium spheres in it. So I am going to put it in a treat to hide it. I'm going to feed it to her. So it's been 15 minutes. We are going to take a lateral and VD view of the abdomen of our patient for our contrast study. So it's been 30 minutes. So we are going to take a lateral and a VD view of the abdomen for our radiographic contrast study. Okay, so the collimation is going to be the 7th thoracic vertebrae and the acetabellum. I'm going to set the collimation. We have our marker, and I am going to shoot the x-ray. Now we are going to do the 45-minute VD and lateral abdomen view for our radiographic contrast study. Now we are going to do the 60-minute lateral abdomen and VD abdomen for our BIPS contrast study.
Hi, my name's Katie. I'm a CVT. I've been working with Tiffany on her radiology for the past few weeks. We started off with a cat. And I noticed that she was a little bit hesitant with a couple of the views, but now that she's studied them, she knows them really well. So when we worked with my dog a couple weeks ago, she was doing a great job with all of her positioning, making sure that she had her marker in place, collimation. She knows all of the correct anatomical terms for everything. The only thing was that we struggled with a little bit was using the positioning tools.